With the coronavirus threat surging in the country, the PMO has once again stepped in to take stock of the situation. The Cabinet Secretary is chairing a meeting with the key state officials to assess the impact of Unlock 1 on the overall coronavirus situation in the country. That's the latest coming in. Cabinet Secretary now holding talks with key state officials to understand the peculiar challenges of each of the states, and then of course to develop a consolidated national policy to combat coronavirus. This meeting comes at a very important stage of the battle against COVID-19 in India. The centre's meeting with key state officials currently underway. The meeting will assess the impact of Unlock 1 in the country. So this is coming at a very important stage of assessing how Unlock 1 has impacted India's battle against COVID-19. The Cabinet Secretary chairs the meeting with state officials. My colleague Madhav joining me on the phone line. Madhav, at this stage, of course, just like in the previous instances of lockdown, at every stage and every phase there was an assessment. Similarly, with the Unlock 1.0 as well, we now see a similar exercise of meeting up with the stakeholders from the various states to understand how India is doing. But the fact remains, Madhav, that we've crossed 280,000. The number of deaths have also crossed 8,000. At the same time, some positive factors of recovery rate and low mortality also being spoken about. What are the important things on the agenda in today's meeting?
Well, one thing is very certain that, as you rightly put it, of course, the government will act in a calibrated manner. Every phase of a lockdown has seen different approach. And in this time round, what is very important is that Unlock 1 is seeing several restrictions that have been removed. And in that light, it is very important to look particularly at the states where the growth rate is high and what really will be the strategy in those states. In particular, what measures need to be adopted in those areas is going to be one of the key aspects of this particular meeting. As you rightly put it, about 2.8 lakhs roughly is the number of cases. But as it is approaching the 3 lakh mark, several places, like for instance, the National Capital Territory of Delhi itself has been reporting for a good part and over a week now in the ballpark of about 1,300 to 1,500 cases per day. What really needs to be done to ensure that social distancing norms and other aspects are taken into consideration and there is no further spread of COVID-19.
Yes, even as we say that, Madhav, let's not forget that at every stage there is a redefining of roles, centre vis-a-vis the states. Some states obviously are far greater impacted than the others, Maharashtra, Tamil Nadu, Gujarat being three such states. So under the circumstances, what is the government's thinking? Can a homogenized national policy work, or is it likely to continue with very specific state-wise policies as it did in an earlier instance of Unlock Phase 4?
Well, I think the focus more is now on the states, and that has been quite clear as far as Lockdown 3.0 is concerned. Unlock, in fact, 1.0 going further in terms of empowering the states as far as the decision-making process are concerned. But as we've seen from differing states, there have been differing demands that have been coming in. For instance, as we talk about Delhi, the LG's all-party meeting that was held recently had very clearly noted that whether they need to look at reopening malls or relook at the opening of malls, places of worship, restaurants, so on and so forth, whether that entire decision needs a revisit. So there are several aspects within states itself that are issues of concern where they feel there could be potential spread of the disease and the countermeasures that need to be taken up, whether it is in terms of hospital or testing facilities, so on and so forth. So several such aspects that each state will be considering and putting on the table, and how best the sector can help them certainly will also be coming up as far as.
Yes. Absolutely. The immediate focus is, of course, to ramp up the health infrastructure, given the projections that are coming for various states, especially for the big metros like Delhi and Mumbai. Thanks for joining us, Madhav, with your inputs on this important cabinet meeting that is underway. And now several stories